Also tonight, the Oregon Health Authority recommends lifting a federal threat to pull certification from a Portland mental health treatment center. The OHA says reviews at the Unity Center for Behavioral Health show it's fixed problems that the state said threaten the safety of patients and staff.
K2's Bob High is live at the Northeast Portland facility. Bob, mental health experts still are worried despite the state's decision.
That's right. They contend that Unity has been overwhelmed ever since it opened less than 2 years ago. And despite this state investigation, that the overwhelming need for mental health treatment here in the Portland area hasn't changed.
Do we need something more because Unity clearly got overwhelmed?
Jason Raynaud of the Mental Health Association of Portland understands why, just months after Unity opened its doors in January of 2017, problems started showing up.
The persons who designed Unity weren't ready for the amount of need there was in the community, and we now need to look at whether there's a need for other facilities as well.
The state investigation into Unity's operations started after a complaint last February. Whistleblower Greg Monaco's complaint, reported by K2 News in August, also launched a county commission investigation.
I witnessed a chokehold that a security guard had placed on a female patient, grabbing her from behind around the neck. So I reported each of these up the ladder at the county, and I just felt like all I was getting was the runaround.
In May and again in July, Oregon Health Authority inspectors found conditions inside Unity that were life-threatening to both patients and staff. A July OHA report sent to federal authorities cited unsafe contraband items in the facility, medication errors by the staff, and one successful patient suicide as signs of the problems. The feds threatened to pull Medicare and Medicaid funding from Legacy Health, which runs the Unity Center. The Oregon Health Authority says 3 days of inspections that ended Wednesday now show Unity's changes have cut way back on dangers for patients and staff.
Their plan going forward is acceptable, and that they can continue to meet the federal and state standards that have been placed on them.
In a statement released today, Legacy Health says it remains focused on safety and well-being for both patients and staff, and is anxiously waiting for federal authorities to act on the state recommendation. It may take about 2 weeks for the feds to hand down their decision on that recommendation. Live in Northeast Portland, Bob High, K2 News.
All right, Bob, thank you. Also, this is